In this video we're going to talk about Raynauds syndrome. And Raynauds syndrome is basically a vasospasm that occurs in the hand, in the fingers. And that can lead to color changes and pain. And it's thought that this happens as a response in some people, not everyone of course, but in some people, to stress or cold. So we're going to talk a little bit about Raynauds syndrome in this video. It's thought that this happens as a result of exaggerated alpha-2 response. Alpha-2, if you remember, are receptors that, if they're activated, they lead to vasospasm or vasoconstriction, and that is the mechanism of action. Now, Raynauds syndrome can be either primary or secondary, and primary, of course, means that it's without any cause or underlying disease. But secondary, there's a very famous underlying disease, and it's called systemic sclerosis, also known as scleroderma. And this is important to remember because they test this on the licensing exam. Scleroderma is the connective tissue disease that can cause Raynauds, so remember that. So what happens if you have Raynauds syndrome? Well, essentially what happens is your fingers, or the patient's fingers, will become in response to either cold or emotional stress, can become painful. They may lose sensation, and there will be changes in the color changes. And I'll show you a picture of a person with Raynauds, and you can clearly see the nice pink color of these digits here, this one here, this one here. But then these ones have clearly been affected by this Raynauds syndrome, and they're pale, and that's very clearly evident. They can also change colors in another way, and they can become cyanotic as well. That would show more of a purplish color. But that's a classic photo of someone with Raynauds syndrome. And like I said, this occurs usually in response to some insusceptible individuals. Cold or stress can lead to this type of presentation. So then how do you diagnose it? Well, the diagnosis is pretty much just clinical, meaning the person's the history and the physical exam. There really is no clear diagnostic study, but sometimes in people that have other symptoms as well, you want to investigate a secondary underlying cause, and that's where another test comes in. And that test, it's interesting. It's called anti-centromere antibody, and that antibody is done to try to detect accompanying disorders. And the anti-centromere antibody is reported in high percentage in patients with a disorder called CREST syndrome. And CREST syndrome is an acronym of 5 things. Each of these letters represents 5 things. Each of these letters represents one thing, and the R represents the Raynauds syndrome. So that's an important one to remember for licensing exams. Okay, and then finally we have the treatment. Well, the treatment, there's meds, and then there's something called trigger avoidance. The first part, of course, is avoiding things that trigger this, so avoiding cold, avoiding stress, and also another thing that's shown is smoking. So smoking can also lead to the vasospasm that can eventually cause Raynauds syndrome, the pallor of the digits of the hand. And the medications involve medications that vasodilate, bring more blood to that to those extremities, and those most commonly are calcium channel blockers, such as nifedipine, and then the other one is the alpha medications, prazosin, for example. And these medications are used if necessary to treat Raynauds syndrome. And now I wanted to show you that picture. I really want you to get a good look at that picture to kind of really understand what you would have on a licensing exam if you were to see something. They'll probably give you a vignette, and then the vignette will probably have at the end of it this kind of a photo, and it's important to kind of get a understanding of what these types of presentations look on physical exam, because sometimes there is no real diagnostic study. And now I'll finish off with a couple of clinical vignettes. A young woman presents to her family physician with complaints of numbness, tingling, and burning of her fingers. She states that these symptoms are typically accompanied by blanching of her fingertips until they are nearly blue, followed by reddening as the episode resolves. The condition described in this initial presenting complaint in over 70% of patients with which of the following diseases? So what they're asking is, the condition she has, what is it associated with? The condition described is the initial presenting complaint in over 70% of patients with which of the following diseases. So which of these would present with Raynauds? So obviously the first part of the vignette, she's talking, or she's presenting with Raynauds syndrome. And what they're saying is, which of these five is Raynauds syndrome the initial complaint? Well, if you remember, if Raynauds is due to a secondary cause, it's most likely due to scleroderma, also known as systemic sclerosis. And that is one of the answer choices. So just to reiterate, if you have scleroderma, 70% of the time the patient will present initially with Raynauds. And then finally, a 47-year-old white female presents with severe Raynauds phenomenon, dysphagia, sclerodactyly, and facial and palmar telangiectasias. Which of the following autoantibodies is the most likely to be present in this patient? Well, this is good because this describes that CREST syndrome. It's a pretty common licensing exam question. Now, what is CREST syndrome? I don't think I wrote it all out. Well, it's an acronym, and each of these letters represents something. The C represents calcinosis. The R represents Raynauds. The E represents esophageal dysmotility. The S represents sclerodactyly. And the T represents the telangiectasias. This vignette describes some of these. It has Raynauds in here, so it's got that one. It's got, well, dysphagia by definition is difficulty swallowing, so that's describing this one. It talks about the telangiectasias, so it's got that in there. So really the question is really a question about CREST, and it's saying which of the following autoantibodies. Well, if you remember earlier in the presentation, I had mentioned that it's anti-centromere antibody. That's the lab test that you would do.